primary veterinarian down at the Animal Hospital in Meadville, which used to be Langdon's Town and Country on Mercer Pike. We've been there since July, so like I said, when Dr. Langdon retired and sold the practice, we bought it and took over. So I'm also the regional medical director for Dog Cat Enterprises, so we own not only the one in Meadville, we have a clinic in Albion, a clinic in Pierpont, Ohio, and then we actually have two in Central PA. So like I said, I kind of make sure the three over here are kind of all on the same page. So. But today we're going to talk about my pet can give me what. So we're going to talk mostly about zoonotic diseases and how we can prevent them. So you guys can't hear me, but basically, like I said, zoonotic disease sounds like a big funny word. And basically what that means is it's any disease that can be passed between an animal and a human. So any disease that your dog, your cat, your cow, raccoon, can be potentially passed on to you. And these can be caused by viruses, bacteria, parasites, fungi, pretty much the whole spectrum of diseases. There's a zoonotic one. There's many different ways that we can get these. So you can come into contact with animal saliva, blood, urine, or the feces of an infected animal. Or you can contract these diseases from something called a vector, which would be getting bit by a tick or a mosquito, which has picked up that disease from an animal and is then going to kind of grow that little disease and then pass it on to you. There's also indirect transmission, which can be eating or drinking something unsafe. So raw milk, meat that's not cooked properly, fruits and vegetables that weren't washed properly, those types of things. You can also get a zoonotic disease from that. So the really good news is all these diseases are absolutely 100% preventable. So with proper hygiene, some vaccinations, and monthly preventative care, we really don't have to worry about our pets passing these diseases on. So we're going to talk about some specifics, the specific disease, how they're transmitted to humans, some common signs, and what we can do to make sure that we don't have to worry about them. So we're going to talk a little bit about intestinal parasites, leptospirosis, toxoplasmosis. We'll spend a decent amount of time on rabies, and then kind of finish up with Lyme disease, which is becoming quite the problem in the area. So roundworms are probably the most common intestinal parasite that you'll find in dogs and cats. Pretty much every puppy and kitten that comes into the clinic has a roundworm. Some signs that we can see in pets from these are they don't want to gain weight properly, they can be throwing up, they may have a poor, dull hair coat, real dry skin, they're not nice and shiny and cuddly. They can have diarrhea, and a lot of times it's those puppies that have those big pot bellies when they come in. They're usually loaded with roundworms. There's 4 ways that pets get infested with roundworms. They can just eat an egg from the environment. So they were out in the yard and a wild animal who had roundworms defecated in the yard. That yard's contaminated. They step in it, they come in the house, lick their paws, they've ingested an egg. They can directly eat an infested animal, so most dogs like to roll and eat stinky dead things. So if that raccoon or woodchuck or chipmunk had roundworms and they eat it, they can now have roundworms. Something special for roundworms is they can actually, if mom has a roundworm and they nurse from her, those eggs will actually be passed in her milk. And they can actually be passed through the placenta as well. So those poor puppies don't even have to nurse. They're just born with roundworms. Because like I said, if mom's got them, those larvae can transfer through the placenta and into the puppy. Once they have one of those roundworm eggs or larvae in their system, those larvae actually migrate through the bloodstream into the liver and lungs. And once they get to the lungs, they're actually coughed up, and then they're swallowed, and that's actually how they get into the small intestinal tract. So it's not like they just eat it, it goes through the stomach, and then they start growing in the small intestine. They actually go through this huge migratory pattern, which will become important once we talk about human disease. Good thing is roundworms, very easy to diagnose. So you bring that little fecal sample into us, which we recommend doing twice a year. We mix it with a sugar solution, we spin it in the centrifuge, and then we stick it on the microscope, and we're actually looking for the little microscopic eggs. Cannot see these with the naked eye. I get people telling me all the time, oh, he doesn't have worms, I don't see any. Well, you can't see them, so that's why it's really important to bring that fecal sample in so that we can look at it under the microscope and try to find those eggs. Roundworms are also very easy to treat. Fenbendazole, milbemycin, moxidectin, and then a drug called pyrantel, which is strongid. It's like that nice yellowy liquid. All treat roundworms very easily. They're safe, they're cheap, and do a really good job. So talking about the human side of it, the zoonotic disease from roundworms is called visceral larval migrans. It's usually seen in children that have been playing in the play box, running around outside, then to wash their hands, those types of things. So when we talked about those larvae migrating through the lungs and the liver in dogs, they kind of do the same thing in people, but they kind of get lost because, well, we're not a dog or a cat, and they don't know exactly where to go. They eventually can't develop because they're not getting to the lungs, getting coughed up and swallowed, so they actually die and they'll cause an inflammatory reaction in the human body. The symptoms are usually generally mild, unless for a chance it actually migrates to the eye, and then you have severe vision loss. That's when it becomes an issue. But they actually think this is a much bigger problem than what we realize because the signs are so small. I forget who did this study, but they were doing CT scans of elderly people's kidneys, and they kept finding these little tract-like lesions in the kidney. And they thought, well, this must be some weird aging change in the kidney that we're not really aware of because nobody's done this study, and that's just how the kidney ages. Well, it turns out most of these people had actually had visceral larval migrans as children and never knew about it. So they had all these scar-like lesions in their kidneys that, you know, when they turned 80, 90 years old were causing problems because they actually had visceral larval migrans as children and never knew it. So, like I said, they're still trying to figure out how prevalent it is today. You know, we have much better medical care than, you know, they did 80 years ago. So, and like I said, we still don't diagnose it very often, but it's still probably out there. Once again, super easy to prevent. So we have lots of monthly intestinal parasite control products. So if your dog's on heartworm preventative every month, that's automatically treating them for roundworms and hookworms every month. So that's a good idea. We want to try to prevent them from scavenging, so don't let them eat and roll in the dead animals if you can. My dogs, that's a very big chore. Prompt removal of feces from the yard and the litter box. Like I said, if we keep it all that fecal material picked up, those eggs can't get into the environment and contaminate it. And then we really want to do fecal exams on your pets 2 to 4 times a year. So we really recommend at least every 6 months. Bring in that fecal sample, let us look under the microscope and make sure there's nothing going on. So very closely related to roundworms is hookworms. It's also another intestinal parasite. Causes a little bit of different diseases, much smaller than roundworms. They take much bigger blood meal, so they can cause some severe anemia. You'll usually see dark tarry diarrhea rather than just diarrhea. They're still going to have that really poor, dull hair coat, and they're really going to have a hard time still putting weight on. So, little different transmission than roundworms. They can still become infested from just eating something in the environment, from ingesting those eggs. They can get it through mom's milk, just like the roundworms, but the special one about hookworms is they can actually just penetrate the skin. So this is why I don't walk around barefoot anymore. You can literally, like I said, dogs outside playing in the yard, pick up one of those hookworm larvae, it gets into between the digital pads, gets into the bloodstream, and you can pick up hookworms. Same thing happens in people, like I said, running around barefoot, playing in the grass, you know, you get stuck with one of those hookworm larvae, they get right into the bloodstream. You're going to do the same thing. They're going to migrate to the lungs, get coughed up, swallowed, and then back into the small intestine. Adults can live much, much longer in the small intestine than roundworms. So they can actually live for anywhere from 4 months to 2 years in the small intestine. So quite some time. That's a lot of time for them to be digesting blood and making pretty poor condition of your pets. So we're going to find hookworms the same way as roundworms. It's that fecal sample under the microscope, and like I said, we're looking for those little microscopic eggs. And we treat them exactly the same, so same drugs. In hookworms, instead of visceral larval migrans, we get something called cutaneous larval migrans. So Hookworms don't even make it into the bloodstream in people. They get lost too fast, so they kind of just stay in the skin. It's generally just a itching, kind of localized rash, red, crusty, itchy, kind of sometimes looks like eczema, which a lot of people aren't going to diagnose because they don't think of hookworms as a skin rash in people. If you have a really, really heavy infestation, sometimes they can have abdominal pain, diarrhea, weight loss, fatigue, and anemia, just like in pets. Pretty rare. Like I said, normally we just have to worry about the cutaneous lobar migrans, like I said. And it's usually on the feet or the hands where, you've picked up that hookworm larva. Prevention, same thing as roundworms, like I said. We want to try to use those monthly intestinal parasite control products. Prevent your animals from eating dead things. Really get that feces out of the yard in the litter box and do those fecal exams every 2 to 4 months. Switching off of the parasites, like I said, those are the main ones that we see in dogs and cats very commonly that can be transmitted to people. Another pretty serious disease that we luckily don't treat very often because we're very good at vaccines for it is something called leptospirosis. Lepto is actually a bacteria, and there's many, many different types of lepto. So it's kind of like buying a different brand of cereal in the store, There's like 6 different types of Cheerios. Lepto kind of is the same way. It's all lepto, but there's a little bit of variation on those different ones. Our signs are going to be much, much more severe with leptobacteria than intestinal parasites. We can see fever, vomiting, diarrhea, anemia, but the big things is it's really going to attack the kidney and liver. So on blood work, we're going to see very high kidney values, very high liver enzymes, and we can actually see protein spilled into the urine because there's so much kidney damage. There's 2 ways that you can pick up lepto. One is kind of direct transmission, where you come directly in contact with infected urine, placental transfer, or bite wound, or ingestion of infected tissue. So same thing, that dog finds that recently infected raccoon that's died and eats part of it, they can get lepto. The other big one that we worry about is in urine. So rodents, deer, raccoons, they really, anytime they go to the bathroom in the yard, there's that potential to come into contact with that urine. There's also indirect sources, so stagnant water pools, so ponds, soil, food, or bedding that has been contaminated with that urine. So, like I said, if your dog happens to be infected with lepto and has an accident in the house, you can pick it up from that bed or, that rug that they've urinated on. Once lepto gets into the body, it's going to move to the bloodstream, it's going to multiply very rapidly, and like I said, it's mostly going to go settle in the kidneys, the liver, the spleen, or the central nervous system. And that's why we see those values elevated on the blood work, because they're going straight to the kidneys and liver. 2 very important organs in the body that we really don't want to be diseased, so pretty problematic here. Diagnosis is not anywhere near as easy as those intestinal parasites. We can't just run a simple screening and be like, oh, yep, saw eggs. We've really got to do significant amounts of blood work, look for those enzymes. We usually always do a urinalysis, like I said, looking for protein. If we see those certain trends in those things, then we have to get specific and send blood work and urine off to an outside lab that's going to test for titers and PCR to really diagnose lepto. So now we're talking several hundreds of dollars to figure out, yes, this dog has lepto. And like I said, these dogs, when they come into the clinic, automatically put into isolation, full mask, gloves, gowns to take care of these guys, because like I said, you don't want those types of infections coming into us, and we really have to be careful that we're not passing that disease between the dogs and the cats and us. So treatment's obviously much more intense too. It's not just a simple over-the-counter dewormer. They're usually on long-term antibiotics. They've got to be hospitalized on IV fluid therapy usually. They usually have to have antiemetics and many supportives. Sometimes they have to go on special diets to combat with the kidney damage. And in very, very severe cases, they might even need a blood transfusion. I can't say that I've ever had one get to that part, but like I said, they're usually in the clinic for about a week, trying to get them over this. And like I said, then they're on antibiotics for about 3 more weeks after that.